Hello there. My name is Travis Broadbeck, and I work at CARES of New York, Inc. as the Operations Technology Specialist. Thank you for joining us, and welcome to today's presentation. We'll be investigating signs of racial disparity in the community by analyzing data entered in HMIS between 2018 and 2020. Let's go ahead and talk about the expectations for today. In just a moment, we'll cover the methodology. But before we do that, let's cover the expectations for today. Today is just the starting point, and our goal is very big and important. Our objective is to come to an agreement with what the current status is of the community. Imagine this like the state of the COC address. We're taking the first step in understanding where we are. And after today's session, we want to start asking specific and pointed questions that will drive lasting change in our community. And by investigating these questions and learning more about the patterns in the data, we'll be able to recommend process improvements and also invest more resources in improving the community's operations. In a moment, we'll cover the executive summary points. But first, let's talk about how this analysis was calculated. First, again, we're looking at HMIS data between January 1st of 2018 and December 31st of 2020. Any records that did not have complete race data were removed. So any records with data not collected, client refused, or client doesn't know. Also, we removed any clients that had an age that was greater than 109 years of age or less than 0 years of age. And again, we're only looking at these 3 years of data by calendar year and not HUD fiscal year. And I do want to mention that we're looking at total admissions. So we are not looking at a deduplicate analysis. We're looking at every time someone shows up at a program, is entered in HMIS, and then receives services. Here are the key points that we can take from this descriptive analysis. First, there is an overrepresentation of Black or African American clients in the homeless system as recorded in HMIS. Whether you compare the population of HMIS to the census or to the poverty population recorded by the 2017 American Community Survey, we do see an overrepresentation. Now, on this point, I do want to recognize the fact that we are seeing folks after they have driven into crisis. So when they are coming to a program requesting help and services, we don't have much information on what drove them into homelessness. We don't have a full control over the systematic barriers and the institutional systems that have driven them to this moment of crisis. So please note that we may not be able to address all systematic barriers and all institutions that have built-in racism, but we can at least start addressing patterns in our own data to better serve our clients when they're in our system, so that we can start working with the community in the future to address those bigger, larger, outside the homelessness issues. Now, our next point that we want to bring up is the fact that emergency shelters are the majority of admissions, but we do see a rise in coordinated entry projects. In fact, the coordinated entry actually had the most admissions growth in the most recent year, 2020. And we do want to recognize that this trend we try to draw in this analysis will be difficult because each year we see a large increase in the number of records that are added to the HMIS. So 2019 had many more records than 2018, and 2020 had many more than 2019. And one thing about 2020, which is unusual, is most COCs saw fewer admissions, and we'll talk about that in a little bit. So we're tying back to the first point in our executive summary, where we're comparing on the left side the HMIS admissions between 2018 and 2020. In the middle, we're comparing the census population demographics. And on the right side, we're comparing the 2017 American Community Survey poverty population demographics. And what we can see here is although white clients make up more than 80% of the community's population, more than 3/4 of the poverty population, 48% of all HMIS admissions were from clients who were Black or African American. The same conclusion is drawn whether you look at the census or the American Community Survey poverty population. In both instances, we see there is an overrepresentation of Black or African American clients in the homeless system. To provide more context to the percentages provided in the previous slide, this slide only looks at the total number of clients admitted into HMIS between 2018 and 2020. So we're not looking at the census or the American Community Survey. And what we can see here is the most obvious data point is that there are more Black or African American client admission records in HMIS than there are white records. You can see that when we have almost 670 clients that are identified as Black or African American, whereas you only have 615 white clients. And that we already know about the census population, so we can see in physical counts this overrepresentation in front of us. Now, tying back to our point from the executive summary, each year the number of records entered to HMIS grew immensely, so the trends we see in the data may be unreliable. And in other communities, the number of HMIS record admissions we actually decreased greatly between 2019 and 2020, which usually told us that there was data that we did not collect due to the pandemic, such as when programs had to reduce their program capacity and offer fewer spaces because of social distancing, the possibility of reluctance to present for services because of fear of getting sick, and the impact of other stimulus programs such as the eviction moratorium and the stimulus checks. All of these have caused, in other communities, the number of admissions to go down, but we're unable to see if that impact also happened in this community because the number of client admissions went up, but we do know there were variables at play that should have actually caused an overall decrease. So we're seeing two variables interacting at the same time. One that actually causes admission records to go up, probably because more projects have been added to the COC or more programs are entering into HMIS, whereas you have the impacts of COVID causing fewer admissions possibly. So it's hard to really break apart those two interactions in this visualization and throughout this whole analysis. In this visualization, we're breaking down the total HMIS admissions by race and year. And what we can see is the proportion of clients by race in 2018 is very different from 2019 and 2020 admissions. In addition to both the proportion, also the quantity of total admissions over years are very different from one another. Now, potential causes of this could be the creation of new programs or improved data quality practices, for example, more programs entering records into HMIS. Now, 2019 is a very unique year for the HMIS admissions, since the number of white clients surpassed the number of admission records with clients that are identified as Black or African American. So in addition to the differences between 2018 and 2020, we also saw a growth in our American Indian and Alaskan Native population that we want to call out because of how significant it is compared to the demographics of the community. So this visualization ties back to the point from our executive summary, where the bulk of our admissions are from programs that are emergency shelters, and the next most popular program type was coordinated entry, with the most growth seen in 2020, which we'll be able to see momentarily. So we take the previous visualization and we break it out into year over year. We can see a few points. First, homeless prevention essentially ended in 2018. They only had one client admission in 2019. And the second point is coordinated entry grew from its infancy from 2018 to a sustainable program in 2020. Street outreach and day shelters are new program types in 2020. And rapid rehousing and permanent supported housing admissions experienced a significant decrease in 2020, most likely caused by the eviction moratorium and the lack of available housing stock, in addition to the social distancing and capacity constraints for a lot of programs. But we can also investigate this further to make sure that those are not the only variables at play here. In this visualization, we're looking at homeless prevention. And I'm not going to comment on it because our sample size is so small. We only have 14 client admissions between the 2 years. So I'm not going to comment on it because we have not even 30 client admissions to look at. So it's not even statistically significant. Now we're looking at street outreach programs. This is a new program type in the community that started entering data into HMIS in 2020. The population is almost approximately 50% white and 50% non-white. In day shelter programs, another new program type that started entering data into HMIS in 2020. The population is almost approximately 60% non-white and 40% white. Now I am commenting on this because we do have more than 30 clients, but once again this is a very small sample size, so just to take these observations with a grain of salt. Now we're shifting our attention to emergency shelters. As we previously discussed, emergency shelters are the most popular program type and make up for the majority of program admissions in HMIS. Now, one thing that is obvious to us, we can see that 2018 data is very different both in proportion and size of records admitted into emergency shelters. So then we look at 2019 and 2020, and knowing that this program type makes up the majority of program admissions, and we saw that throughout the entire HMIS, we have more admissions of Black or African American clients. Interesting points here are in 2019 and 2020, we see more white client admissions in emergency shelters than Black client admissions. So again, we did talk about the issue with trend in this data and the impacts of COVID. So we're just going to call out this point and keep our eye on it for the future years. Now we're looking at coordinated entry, which started to take off in 2019 and continued to grow in 2020. One change that we see is the proportion of Black or African American client admissions compared to white client admissions essentially flipped between 2019 and 2020. We can see in 2020, even with the impacts of the COVID-19 pandemic, we have more clients that were admitted of Black or African American descent than white descent. In rapid rehousing, we did see a spike in admissions in 2019, but a decline in 2020, and that decline in 2020 was actually lower than 2018 admissions. Part of this could be caused by the eviction moratorium and other stimulus programs, so we're going to call it out here and keep our attention on it for future years. Our final program-specific visualization is permanent supportive housing. And what we can see is year over year, there is a decrease in admissions into permanent supportive housing programs, with the most significant decrease occurring in 2020. Now, part of this decrease in 2020 could be the impact of the COVID-19 pandemic, where we see the eviction moratorium and other stimulus programs making new admissions very difficult. Another interesting finding is year over year, the non-white admission count for clients is larger than the white client admission count. Now, this is something we just want to notice and observe because we did see a change in the demographics in emergency shelters. And there is a chance that folks who leave emergency shelters could be referred to a permanent supportive housing program. So just to think about that possible change in our demographics in future years to come. Now we're going to look at 3 final visualizations before we wrap up. These will be the interactions between race and gender, race and veteran status, and race and disabling condition. In this visualization, we're looking at the interaction between race and gender. What we can see in this visualization is that nearly 2/3 of all client admissions are male. This is pretty important for the community. It'll help when they are planning for future beds and units. Another point that we want to call out is even though we don't have many clients that are admitted into HMIS that are identified as Asian, of all those clients that are identified as Asian, they are all male. Another point that we also want to call out is the share of white male clients and the number of black male clients is virtually identical, whereas we serve significantly more Black or African females in the COC than white females. Just knowing that difference when we think about race and gender right there. In this visualization, we're looking at veteran status. And what we can conclude is although that we're looking at nearly 1,400 client admissions, less than 45 admission records, less than 50 total, indicate that the client is a veteran. And of the veteran population, more than 2/3 of all veterans are white. Now we want to investigate if there's a possible data quality issue. For example, some clients may not report as a veteran if they were dishonorably discharged, if they were not in active duty, or if they were part of a state National Guard rather than a federal military branch. When more clients have documentation proving their veteran status, then they can access more program types to address their needs. In this final visualization, we are looking at the intersection between race and disabling condition. Now, the first thing that strikes me is the fact that we have more white clients with a disabling condition than those of clients of Black or African American descent. And the reason why this stands out to me is because there is ample academic and community research that states that communities of color have less access to quality medical services for multiple reasons. There could be variables such as access to transportation systems or how far the medical system is, the potential impact of stigma when you think about mental illness and substance abuse, or other variables like having a past experience that did not go well, so clients are more reluctant to see a doctor. All of these could be possible variables in addition to not having affordable insurance, for example. So when we have these variables at play, there's a chance that clients do not have the documentation about disabilities that they may have, therefore making them at a disadvantage when they enter the homeless system when they don't have the documentation that would put them in program types that can address their needs. So what we can do is investigate this issue further and really identify if there's an underreporting of clients with a documented disabling condition. And if there are, then we could investigate ways we can partner with the community. For example, we could partner with a mental health professional in the county who could do on-site assessments. And the same could be with a substance abuse treatment, because those could be 2 conditions that could help folks get into permanent supportive housing programs or other program types that can serve their needs. So we're investigating this issue because we think there could be an underrepresentation, and we have ideas on if we do identify an underrepresentation, what we can do about it. So I want to thank you so much for your time and attention. This has been a really enjoyable presentation, and I look forward to your feedback and your questions. If you're curious about the data that we collected all our HMIS data from HMIS Awards, we collected our American Community Survey data from the HUD Exchange, and we collected our census demographic data from the United States Census website. Thank you so much and have a great day.